Hello everyone, I am Dr. C. Ravindran from Baby Memorial Hospital, Calicut. I am going to discuss with you an important aspect of the management of asthma. That is asthma control. When we initiate treatment for an asthma patient, we always face few questions. Most important are, patient may ask you, is my asthma curable? Second is, do I have to take medicines lifelong? These are two important aspects as far as the patient is concerned. And when we answer these questions, are we correctly answering them, or are we sincerely attempt to cure the disease? We know that cure for asthma is not possible. So in such a situation, what is the next important stage where asthma is nearly cured or the patient is asymptomatic? So most of the time, lack of awareness of the natural history of asthma, both on the patient side and from the treating physician side, creates problems. Second is improper patient education about the natural history of the disease and what will happen on treatment to this patient is very important. So these questions should be properly answered and the patient should convince on those things so that there will be a mutual understanding between the treating physician and the patient on the patient's future symptoms. When we put the patient on asthma management, there are few important things we should look at. We have so many medicines available in the market. We can use all of them, but when we use them, what are we trying to achieve? One is to achieve early control in all asthma patients whom we are treating. Second important thing is to maintain this control. Very important because patients should be always under control so that new symptoms will not develop. For this, what we should do is we should regularly follow up the patient. And the treatment should be sometimes stepped up or sometimes stepped down according to the presentation of the patient. So we will discuss what is asthma control. Asthma control are few important points or parameters by which we say that the patient is living normally without symptoms. Most important thing is to avoid troublesome symptoms during day as well as night. Second is patient need not use a reliever medication. We are treating with anti-inflammatory medication. And if the patient wanted to take reliever inhaler in between frequently, that shows poor control. Have a productive and physically active life. Patient should be able to lead a normal routine life. And when we measure the lung function, their lung function should be normal. Even if it is not normal, it should be near normal so that patient's exercise capacity is good. And lastly, we should avoid exacerbation. Once we initiate a patient in asthma management, our prime aim should be to avoid exacerbation in such patients. We know that exacerbation brings new symptoms, worsens existing symptoms. So control becomes a failure there. And when we achieve all these 5 parameters in our asthma patient, look at that, it is equivalent to almost cure because as far as the patient is concerned, they are asymptomatic, they can lead a normal life, means it is equivalent to cure. So how will we achieve early control in asthma? When a patient presents to you, first assess the severity of asthma. When you make a diagnosis of asthma, look at the severity of the disease at presentation. And that decides the dosing of medicines. We have in anti-inflammatory drugs in the form of inhaled steroids, along with that symptomatic and anti-inflammatory agent, long-acting beta-agonists are there. A combination is usually given. And the dosing of these two medications is based on the level of severity of asthma. And second, when we put a patient on inhaler, we should teach the patient on the inhaler technique. Proper technique is very important. Then second is we should see that the patient is taking these inhaler medications. That is, compliance of treatment is important. And this patient should be followed up frequently till the control is achieved. So when we look for control, not only the medicines given for asthma is important, there are some other factors which we should look at. One is identifying the comorbidities. Most important is upper respiratory symptoms like allergic rhinitis, nasal polyposis, and sinusitis. And unless we control these diseases, it is very difficult to control asthma. So very important to identify the comorbidities and treat them. And second one is gastroesophageal reflux disease, which again worsens asthma. And GERD can even precipitate new asthma. So such patients should be put on anti-GERD measures to control the GERD so that it will not worsen asthma. And third, infections. They may get frequent infection. Whenever there is an infection, viral infection in the family, these asthma patients get this infection and their symptoms worsens. They go for exacerbation. So viral, bacterial, respiratory infections are important points which we should look at. Then important one is the triggers. Triggers include allergens and non-allergic substances which can worsen asthma symptoms. So we should be able to tell the patient about these allergens and so less other trigger factors and tell them to avoid such things in the day-to-day life. And this includes pets inside the house, molds, house dust, and insects, which are all indoor pollutants. Then exposure to kitchen smoke is very important, especially when they use biomass fuels. They may get worsening of symptoms. Then outdoor allergens are also important. Pollens, diesel exhaust, grain dust from industries, mills, bakeries, all these things can worsen asthma. And food allergy is another important aspect. And food which is allergic to an individual can induce bronchospasm, severe bronchospasm. And all the patients need not be put on the same line of management. We should look at the patient, their severity of illness and the type of asthma they are having and the type of allergen they are having, type of comorbidities they are facing. So based on that, we can customize the treatment based on level of asthma control, risk factors for exacerbations, phenotypic characterizations, especially certain patients will not respond to routine management. They may need biologicals. And preference of the patient also is important. Certain patients may not like to take inhalers. They may metered dose inhalers. They may go for dust, other type of inhalers. All these things are important. And we should also try to respect the preference of the patient to a large extent. And available medications, their effectiveness, their safety, and their cost are also important in customizing treatment in these patients. And once we control asthma, next step is to maintain this control. Maintenance of control is for the patient's life throughout. So maintain control with the least medication is the most important aspect we should look at. For that, we should regularly follow up the patient to see whether the patient is under control or they have frequent symptoms. And during each visit, we should check the compliance with medications, look for inhaler techniques, and also discuss with the patient about their environment and presence of pollens or other allergens in their environment. And if the patient shows some symptoms beyond the control, we should step up the treatment. And if the patient is improving and they are better, never forget to step down treatment. That will increase the acceptability on the side of the patient. And another aspect in the management and which will make some problems in the control is exacerbations. So all the patients on treatment may face exacerbation once in a while. And these exacerbations are usually due to infections, viral or other atypical organs. So it may also be due to exposure to heavy dose of allergens or other triggers. which can worsen asthma. And discuss all these things with the patient about the triggers and about frequent infections, and try to avoid, tell them the measures to avoid them. And in summary, it is important to spend some time with the patient discussing their environmental factors, their treatment compliance, their inhaler techniques, all these things which will improve patient complaints and proper control of asthma. And this patient, every time we should discuss. Sometimes the patient on treatment may not be having any pet in the house. Later, they may purchase a pet inside the house. And naturally, patient's asthma control will be failed. So such things should be discussed during each visit and try to control those factors. And patients should follow the treatment properly. This proper compliance is very important. And similarly, proper technique of inhalation also is important, because patient on control may not follow the initial instructions as such. So such patients should be taught about the inhaler techniques frequently. And these patients need regular follow-up to ensure control, and if needed, step down to the lower level, or if needed, step up to the higher level to achieve proper control and maintain a control throughout the patient, so that patient will not be having symptoms and they will be leading a normal life. So patients, we can say that they are out of symptoms and they are properly controlled. Thank you very much.